Anybody that meets the safety standards for having laser vision correction is generally suitable for PRESBYOND. Depending on the technology one uses to perform the laser vision correction, they have some slightly different ranges. But certainly from our own experience, we have treated from a nearsightedness as much as -12 to farsightedness as much as +5, which really covers probably at least 98 to 99% of people out there with refractive errors and astigmatism of up to 4 diopters. Now, are there some people way outside of that range? Yes, and are there some people in whom there are already at a very young stage of life very significant lens changes that are definitely going to become a problem, and whom then it may be better to look at their lens rather than at their cornea? Absolutely, it's possible. But that's why if you were to come to us, we would, as the very first step we do, perform a test that separates out the quality of vision based on what is the quality from the window to the eye of the cornea and what's the quality from the lens. If the quality of the lens is greatly compromised, then we'll sit you down and we'll talk to you about maybe considering a lens-based solution so it has a different risk profile. The whole beauty of something like PRESBYOND and a laser-based correction is there is no real risk that you could go totally blind from the procedure. Once we go inside your eye, we're facing a different risk profile. There's some risk to that the lining of the inside of the eye, which we call the retina, may develop some problem in the first few years after a technically beautiful operation. There's a whole different ballpark. And then there are some people that have truly dry eyes to begin with, in whom laser vision correction is just maybe not suitable. And we look at that. And then there are some people in whom the test pick up some potential structural issue with the cornea where there may be some inherent weakness. And because we're reshaping the cornea and reshaping it and taking something away, then doing on something that has some pre-existing weakness is not a good idea. But really we'd have to, there's no good way of yourself knowing this from beforehand, because there's no indicators to yourself unless we've got some terrible dry eye disease and you're putting 30 lubricating drops in a day. Well, that's probably not a good scenario to do anything to the eye. Our goal is to find the right solution for the right patient. So it's not squeezing everything into one thing, or they're like with other things in medicine and health, they're general guidelines, but they have to be interpreted and customized to an individual person. There is no one solution that is best for every single solution. So the solutions may be based on a correction of the window to the eye, the cornea, and that may be PRESBYOND, or there's the odd patient that will absolutely not tolerate any difference in vision, in which case we can put on some depth of field, but not necessarily the full PRESBYOND treatment. There are other patients where there's clearly an issue with the quality of the lens, and an issue that'll almost certainly get worse, in which case we will contemplate and consider with the patient a lens-based solution. And then there are some other people who, unbeknownst to them, you come in and look at you and do our full exam and do all these tests, and we find, no, there's actually something else going on with the eye, and really you actually have, God forbid, a medical condition that's affecting your vision that you're unaware of, or sometimes not affecting your vision, but you still have a medical condition, and then we'll look after that. We do offer the full range of medical treatments, and then we'll sort that out for you.